All right, in this video, we are going to talk about some of the equipment that is needed for reflex cough testing. In a previous video, I went over what will be needed for voluntary cough testing, so you can certainly reference that as needed. When doing reflex cough testing, we need a few different pieces of equipment. The first and foremost is a peak flow meter. So a peak flow meter such as this is typically used for breathing and assessments of respiratory function, but it's certainly been adapted to assess cough function. A peak flow meter measures kind of the quickest velocity of airflow. Typically, this unit is in liters of air per minute or per second, with a higher number indicating faster air. For cough, we associate that with a stronger and more effective cough. The peak flow meter that I like to use is the Omron peak flow meter. This is available on the Omron store as well as online platforms such as Amazon, and it typically runs around $15 to $20 for this analog version. There's been research that's compared analog and digital peak flow meters, and they're essentially just as accurate as one another. The one benefit of a digital peak flow meter is that it can also capture the amount of air that's exhaled during a cough, typically within the first half second or second. But peak flow rate, cough peak flow rate is typically what we're looking for when we're doing cough assessment. This Omron peak flow meter, the reason why I like it has to do with the dimensions of its connections. So when we start to use peak flow meters and pair them with respiratory filters and other tubes and face masks, we need to be thinking about the dimensions of the various connectors so that they all kind of match with one another. So I've searched through lots of different peak flow meters and different setups, and this is one that I've found that seems to be commercially available and relatively affordable. So this peak flow meter comes with an intraoral mouthpiece that connects to the peak flow meter. There's kind of a larger end and a smaller end. For voluntary cough testing and reflex cough testing, what I'd want you to use is to actually insert the smaller end into the peak flow meter. That's, I think, not how it's typically designed, but it's what we need for the dimensions for this cough testing. So you'll stick the smaller end in the peak flow meter, and you'll notice that it doesn't feel like it fits all the way, but if you push it with a little bit more effort, it secures with no air leakage out. So if someone was just coughing normally into a peak flow meter, they would place the intraoral mouthpiece in between their lips and teeth, and they would cough into it like that. But you can imagine that we probably can't use the peak flow meter between patients if we are having them cough directly into the peak flow meter. In fact, peak flow meters are typically considered to be a single patient use device. However, when adding a respiratory bacteria filter to it, many institutions allow these devices to be used between patients, disposing of the respiratory filter between patients and then washing and or sanitizing the peak flow meters. That's the case for many institutions, and it's also the case for our institution. So for us, we've purchased a bulk set of peak flow meters. We use them between patients. They get sanitized and washed between patients, but they're always used with a respiratory filter. So this is the respiratory bacteria filter that we use. This is the ordering information for your own purchasing. Again, these are single patient use, and you would dispose of them after a single patient encounter. There's a bigger end to the filter and a smaller end to the filter. You'll be placing the bigger end of the filter around the bigger end of that intraoral mouthpiece and squeezing to make sure that there's a nice snug fit between this. So if you're doing voluntary cough testing, you could have the patient wrap their lips and gently bite on the filter and cough directly into it, like that. I actually prefer using a face mask. I feel that the coughing condition is a little bit more natural, and so we might elicit a slightly different behavior by attaching a face mask to this. Before I show you that to you, just to show you again how this peak flow meter works. So you see that I just coughed and a red dial went all the way up here, indicating that my cough was around 330 liters of air per minute for the peak cough flow. You would then reset this between trials, have the patient cough again, like that, and now we see that I'm up to around 370. and you'd reset it. We have extra little markers here, a green one, a yellow one, and a red one, and we can set these markers to various ranges if we're doing something like cough skill training, where we might want them to kind of cough at various ranges to kind of explore their cough. So you could use this for cough therapy. Otherwise, you might just kind of keep these down and just kind of focus on that red dial. Making sure to, again, reset it after every trial, and also making sure that patients are using the handle when coughing so that they don't accidentally hold onto this device and block the meter from moving. Okay, so we have our respiratory filter, we have our peak flow meter. We have it connected to the intraoral mouthpiece and the respiratory filter. Like I said, I like to use a cushion face mask when doing voluntary and reflex cough testing. So you can connect this face mask to the smaller end of that respiratory filter, and it should be a nice snug fit. This is the ordering information for that cushion filter, or cushion face mask. So this would be the setup actually for voluntary cough testing. That would be a single cough. My cough was around 360 here. If I did a sequential cough, and here we're at around 280. Okay, so this would be the setup for voluntary cough testing. If we add reflex cough testing to this element, we need a few more pieces of equipment. First, I'm going to set this aside. First, we need a compressor nebulizer. The compressor nebulizer attaches to a nebulizing chamber containing liquid solution that should make someone cough. But people aren't drinking the thing to make them cough, they're breathing in and out fog. And so the compressor nebulizer makes that liquid solution a fog for someone to breathe in. The compressor nebulizer that I use is the Pulmomate. You'll see that it has a handle here, so you can kind of carry it between patients as needed or between rooms as needed. It does have a cord, so it needs to connect to a 3-prong outlet in the United States. I'm sure they've got international versions that have just 2-prong outlets. So this is what the Pulmomate looks like on the exterior. There's a lid here that opens up. You'll connect a tube here. The tube will connect to a nebulizing tube, which is then connected to your peak flow meter. And this is an on-off switch. So if I turn it on and turn it off. So you'll need that. This nebulizer runs around $50 to $60 US typically. In some stores I've seen them around $100, but typically around $50 to $60 US. Then we'll need some sort of nebulizing chamber and connecting tube. And so the purchasing information that I have is here. There are many distributors that have the contents contained within this package. This is just what I found for a relatively good price. When you get this, it'll come with a package with a few different pieces of equipment contained within the package. Two of the things we do not need, so it's a little wasteful, and I apologize about that, and hopefully I can find something in the future that isn't as wasteful. But there are 3 pieces of equipment in that package that you do want. You'll need a nebulizing chamber that we put our liquid solution into. You'll need a T-connector, and then you'll need our tube. So the tubing just connects from the nebulizing, from the compressor nebulizer and it will connect to this nebulizing chamber, which I'll do in just a second. In the nebulizing chamber, we need to put some sort of solution that should make someone cough, or that they should ideally perceive. So you'll need some saline solution. And then you'll need some sort of tessogenic agent like capsaicin or citric acid. Those are the 2 most commonly used products for reflex cough testing. I typically use citric acid now. I was trained using capsaicin. I've switched to using citric acid. It's a little bit more commercially available. You can certainly find it on places like Amazon. And then you would mix the citric acid into saline until you've reached your desired concentration level. There's a really good article by Dr. Anna Miles and colleagues that have looked at threshold testing, meaning looking at various concentrations of saline and citric acid in healthy adults. And so I mix my solution to about 0.8 molars. So I've already added the citric acid here. In terms of who can prepare this, it depends on your institution. Some institutions will require pharmacy to prepare this for you. Other institutions might have nurses or medical assistants prepare the solution for you. Other institutions might allow SLPs to prepare the solution for you. And in fact, that's the case for where I'm at. And so our SLP team prepares the reflux cough solution in a sterile environment, and then we store it in a sterile refrigerator as well. So here we've got our citric acid. This would all be done in a sterile environment as well, but for the purpose of this demonstration, I'm just doing it in my office right now. So we would add this solution to our nebulizing chamber. Put the cap back on. Great. Now I'm going to connect the other end of this tube to the bottom of the nebulizing chamber. Then I'm going to attach the T connector to the top of the nebulizing chamber. Then I have this previous setup. So the first thing I'm going to do is get rid of this face mask temporarily. I'm then going to place the filter on one end and then the face mask on the other end. So this is our setup for reflex cough testing. What you'll do for the cough testing is have someone breathe naturally. After around 3 stable, relaxed breaths, when they start to exhale, you're going to turn the nebulizer on so that whenever they begin to inhale, they're being exposed to fog. The idea is that we're trying to control lung volume initiation for the cough. We're trying to control when someone is exposed to the citric acid fog. So we want everyone to be exposed immediately upon inhalation. So to do that, we turn it on during exhalation. So you can see what this looks like. When we turn it on, you'll see fog start to come out.